Hello, everyone. Let's see, Janie Macaroni. Hello, how you doing? Sona. Hello, Florida country girl. How are you doing? A beautiful day. Fireside chat. I've kind of organized things a little bit. Can you guys hear me? Okay. Lewiston. Jen. Hello. Hello. Welcome. 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 Amber. Hello, Amber. How are you guys doing? Let's see. Instagram, Facebook, and YouTube. We're just sharing some thoughts and ideas. Let's see, it's May 2nd. Wow. Zipping by the universe. Heather, good morning. Jessica, again, good morning, good morning, good morning. Thank you. Just making sure it sounds good on all sides. I've made some adjustments. Always, I've been doing spring cleaning. I literally cleaned out my office here at home. I'm working to the same thing, getting rid of junk, and clean out all the mess. I put some new pictures on the wall, some from Tia, some of mine. But remember, you guys are the artists every day. Natalie, Jillian, good morning, good morning. Topsy, let's see, Aussie, Elegant Reader, hello. And Mrs. Razzle Germain, good morning to you guys. Answering questions, concepts, ideas of why are we all suffering this infertility journey? What's the problem? Is maybe there's some inflammatory things going on in our bodies that are harming us. That's where I think it's all coming from. And you know me, I'm crazy on keto, and Dr. Kiltz's keto lifestyle. Check it out on Amazon, our new Fertile Feast book. And I just came out with Living Your Best Life, which just kind of mixes a little of the old and the new. I wrote it about maybe 8 to 10 years ago, and I just got it published. So let's see. Irene, good morning. Saudi Arabia. From all over the world, we're all in this global village, and we're learning to be better. And this pandemic of COVID has brought us inside and teaching us a lot of new and different things. That's really the trick and the challenge. We all need to be focusing on new and different and slow it down. All right. Hey, let's see here, making sure the incredible shrinking Foy, good morning. Good morning. A shout out. Hello. Listen, all of you guys, if I don't mention you guys, I apologize. I'm doing my very best to get to everyone, answer questions, thoughts and ideas. Let's see. Kiltz's keto lifestyle. It's really simple. Always faith first, right? You have to believe in this higher power that we have labeled God, but it's all of us. It doesn't matter if you're a God believer or not. It's the energy, and the thinking brain changes the outcomes of that which you desired. So change the thought, change the outcome, and practice it every single day. It's kind of crazy concepts, right? And faith and fertile fatty foods. This is why keto is king, but one meal a day. And if you read my family building guide, my lifestyle stuff, it's kind of fun and interesting. But listen, you got to have fun with all of this. And it is crazy concepts and ideas that I've learned that are a game changer. Having a lot of headaches on Omnitrope. Let's see, 6 units. Yalitza, if it's for try 3 units, if it's for priming, I go down to 3 for priming all the time. Naritsara, good morning. Inflammation. Office offered blood test screen the level of inflammation in your body. Yes. And I'm working with a new panel for inflammation through Presimune. Dr. Vidali has really come up with a great concept, but highly sensitive CRP. You can look at ESR, ANA, ACA, lupus, all of these things. But number one, if you're infertile, you've got inflammation. It's simple. And it is actually from our healthy lifestyle and diet, which has not been healthy at all, which I know it seems like a little crazy concept. Let's see, 20 weeks. Awesome. Brittany. All right. Great successes. Share the success stories, right? Share what you did to get to the success you're at. Share it with others. And remember, there are plenty of people that look inflamed and unhealthy and they have babies, but you're not. And why not? This is the mystery. But if you look at Kiltz's keto lifestyle, it cures, by the way. That's a game changer. Fasting, was like the best thing I've ever learned in this life. One meal a day at night. For me, it's mostly fatty meat. I'm mostly a carnivore. For others who choose to be vegans or vegetarians, add the fat, one meal a day, and cook the carbs well. It's really simple, by the way. Joy, hello. Altamis, good morning. Let's see. Teresa Ann Weiss, good morning. Devin, misdosed and took way too much Omnitrope. It's okay. It's all going to be good. It won't hurt at all. So you'll be good on that. How do I get myself into ketosis? Lee Av Lowy. I don't measure ketones personally. I basically do one meal a day. That is like the easiest, simplest thing. It's a new habit. I've been off coffee for like 3 weeks now. Water. I do a little sparkling water, but if you read Kiltz's Keto Lifestyle, look at Maria and Craig Emmerich stuff. They have really great stuff, but I don't measure my ketones. It really is. Fasting is like the number one thing. One meal a day at night, rest and digest. And then you can do a little snack, but make it fatty, cook the carbs. And I do eat a little ice cream and chocolate from time to time because I love it, reward myself, right? But most of the time, no. And alcohol is deadly. Marijuana, it's all deadly. But to go into ketosis, if you read, let's see, The Case for Keto by Gary Taubes is really a great book. Marie Emmerich's on ketosis is awesome. But it's really, there's so many amazing people sharing thoughts and ideas out there that are helping all of us to be healthier. And remember, you're in charge of what goes in the mind and the mouth. Take control of that. Don't give it up at all. Brittany, getting excited consult this month. Brittany, we look forward to talking to everyone. If you read Kiltz's Keto Lifestyle, go to our website. Oh, the Family Building Guide on Amazon. It's like $5. I don't know. It's well worth the small investment, but you're worth the largest investment because remember, you're the most valuable, irreplaceable person ever created in the universe. All right, let's see. CBD oil. Where did I see that? We do a little CBD. Lee Reed. So basically, infertility and failed IVF or implantation is due to inflammation. It's a simple concept. Inflammation is caused by a high carb, low fat diet, 3 to 6 meals a day. Uncooked carbs are deadly to me. And too much exercise, a little weights, a little light movement, a little yoga and Tai Chi and all those things, right? That you want to go slow and slow it down. But remember what you put in the mind. So you have to have faith and see what you're doing. But CBD oils and omega-3, it's anti-inflammatory. It reduces inflammation. It's a phytochemical also. Remember, some people are not good with some of these phytochemicals, so it may be good for you, but it may not also. Let's see. Any endometriosis specialist to diagnose in CNY and surrounding areas? Dr. Lutheringer, myself, do a lot of endo. Dr. Vidale, Dr. Condrup, Dr. Montalto is in Albany area. Condrup is in our Florida location, Sarasota. We're coming in a month or two. We're going to close on it in a couple of weeks. We're excited about it. We'll be working mostly at Doctors Hospital down in Florida, but whoever your doctors are, we'll help them help you. And we'd be glad to discuss endometriosis. Endometriosis is an intra-abdominal pelvic inflammatory disorder. In my opinion, it's the leading finding in infertility. If you're not implanting, failing to get pregnant, miscarriages, failed intercourse, IUI or IVF cycles, endometriosis. So in upstate New York, Dr. Steve Brown, Dr. Myron Lutheringer, those are the people in our local area, but there are lots of endometriosis experts in this country, in the world. Talk to your local, whether you excise it or vaporize it. It depends on the location, the size, the depth, in many ways. Some people need a bowel surgeon, a cardiothoracic surgeon, depending if you have endometriosis in other places. We take care of it related to fertility only. Shona Mamtora, 41, falling pregnant, no problem, have 2 miscarriages and now on progestin positive, any advice on getting this pregnancy to hold? All right, Kiltz's keto lifestyle. Number one, keto is an anti-inflammatory lifestyle. Again, you don't have to be in ketosis. It's one meal by fasting, reduce the carbs in the bloodstream, which reduces inflammation. And then this is where aspirin 81 to 100 milligrams, Lovenox, prednisone, a steroid, maybe an antibiotic protocol. If you go to our family building guide on Amazon, a lot of good stuff there that you'll find. But basically, not getting pregnant and getting pregnant and miscarrying are all the same cause. Even genetically or chromosomally abnormal embryos are due to inflammation in the male and in the female. Remember, it's always the sperm, it's always the egg, it's always the embryo, and it's always the vessel that carries the baby. All right, Haley, second transfer has failed. Last transfer told me to add letrozole, 10 milligrams prednisone 2 times a day on top of everything else. Keto, is there anything else we could do to next transfer? Laparoscopy, hysteroscopy for endometriosis. Look at, again, our family building guide on Amazon. Look at laparoscopy, hysteroscopy, Kiltz's keto lifestyle. It's a game changer, in my opinion. And this is where level 4 IVIG and Humira could come in also to improve the implantation. IVIG is like the vacuum cleaner to clear up all the antigen antibody interactions. It'll help calm your own inflammatory responses to those antigens. So it's basically clearing up all the antigens. I mean, essentially, the COVID vaccine is given to create your antibody response to mop up any antigens that get in your body and not allow them to get a foothold and cause more inflammation. Living with Jana, CNY success rates. You can go to the CDC and go to SART to find all of those. But remember, they're highly biased and inaccurate, in my opinion, because if I'm selecting who I want to help or not help or numbers, if you're allowing people to go through multiple cycles, you're going to have lower numbers overall. But I think we have excellent success rates. But the only success rate that matters is yours. You're not a population, you're an individual. The hard part is to know what your individual success is, but you have to have faith that you're going to be successful. How it happens, you got to leave it up to the big woman, the big man, the big team in the sky. Jessica Papp, would it be worth to see an endocrinologist? Are there any ways that helped any of your patients? Yeah, endocrinologist, immunologist, rheumatologist, naturopath, a chiropractor, acupuncturist, a physical therapist, all of these things, but mostly a therapist, right? Our new Fertile Spirit is a new offerings that you can talk to someone, either visual or just on the phone, and get some support in this crazy journey called infertility, right? But remember, I am fertile. I'm living a fertile life. All things come to me as I believe they are. And if the more you believe, the more happens, and it's more amazing than you've ever known, right? Let's see. Brittany Bertani, I was pregnant first FET after using immune protocol. Big believer. If you look at our 1, 2, 3, and 4 immune protocols, and we're going to be coming out with a new testing panel with Dr. Vidali and excited about it. I know how many people want to know, am I inflamed? Well, if you're infertile or you're miscarrying, which is the same to me, you have inflammation. Inflammation is the cause. Unless you have an anatomic structural abnormality, which can be repaired. So we have to look at fibroids, septums, scar tissue, polyps, all of those things, by the way. All right. Carrie, by the way, the comments are not private in case you didn't know your friends list can. Yes. And look at, if you want privacy, don't have social media, don't connect in any way. But the more you put it out there, the more you let go of the things you're trying to hold on to, the truth shall set you free. Give it up. Let the universe know about it. Oh, and don't forget, you got to journal every single day. You got to write in it. How are you feeling? What are you thinking? And then you have to read books that are going to inspire you to change your thinking. When you change your thinking, you change everything else in your life. Remember, you're the creator of your life, and you're fertile, by the way. PCOS equals inflammation, 100%. Polycystic ovarian syndrome, metabolic disorder, is mostly due to a 3 to 6 carbohydrate-filled meals a day. If you do it in one time a day and nothing else, that is the best way to get to. It's fasting. And fasting is lasting, and yoga, meditation, and whatever you're doing in this world. But if you want to pump a little iron, go to a yoga class or Tai Chi. But if you want to do a little rowing, a little biking, a little light exercise, okay, for a little mental clarity. But keep it cool and calm, right? And there's so many different ideas on this. But yes, metabolic disorder is prediabetes. And I believe our hemoglobin A1C levels are too high as normal. Our glucose levels are too high as normal. We're probably meant to be in the hemoglobin A1Cs in the 4 to 5s, and maybe even the glucose levels in fasting in the 40s to 60s. That's my bet in this. We do not require glucose or carbs to be eaten ever. Morgan, blood pressure, sugar problems, and cannot fast. What do you suggest? Well, we are addicted to sugar, and it's going to do everything it can to get you to eat it because your body wants you to get fat. So in fact, you can go without sugar because we're built to go days and days and days, maybe weeks without food. That's why we get this thing called fat, probably put in places that we don't want them, right? But fat is the fertility fuel for the Ferrari. And remember, we're Ferraris. So it's a practice, this idea that every time you take a sugar, and it's like taking a cigarette or a drink, thinking, oh, I can't live without these. I'm addicted and I'm withdrawing. Your body is going to fight you tooth and nail to get that sugar. And I know I feel the same way sometimes, but it's a practice. It takes time. And if you eat fatty meat, for me, but if you're going to eat a carb because you're a vegan, make sure you add the coconut oil, hemp seed oil in all of this. And go days without eating. That's actually the game changer. But I think it's hard to do anything like if it isn't every single day. So one meal at night, but you can do it earlier if you want, but you got to work on more naps, by the way. Jamie Allison, thank you. Journal, write to your unborn baby. It really does help. I have a journal for my son that is amazing. Read it now. Look at, think it, ink it. The more you write what you desire in life, the more comes true. That's what I've learned for myself. Like now I'm 65. Let's see, I'm on my way to 66. And it's just amazing what I've learned as a physician. Health and wellness and a healthy lifestyle is not at the gym. It's not eating 3 to 6 smoothie-filled meals a day. It's mostly doing it in one. And go slow and cool it down. And yes. Let's see. Transfer levels of 3. You can transfer the TSH3. Make sure your T3, T4, and free levels are all normal. And add some 25 to 50. You may even do some of the Armour thyroid or let's see, NT natural thyroid hormones. 2 rounds of letrozole for FET, PS Mama 19. So do the letrozole trigger or add 2.5 of letrozole to our standard estrogen protocol. And don't forget the endometrial receptivity panel or assay. Cooper Genomics offers it, and so does iGenomics. Sabrasita 2001. PCOS, haven't had a period in about 5 months. What can I start getting my period constantly? Keto. Kiltz's keto lifestyle. Maria Emmerich, Craig Emmerich, and Kiltz are coming out with a cookbook coming out. We're really excited about it. I do love to cook, but I'm a boring cook nowadays. It's steak, steak and eggs. But if you want to, let's see, Progesterone, Provera, Prometrium brings on a period if you have a thick lining, if it's thin, but you don't have to have a period to start on these treatments, by the way. All we need to do is simply check a lining with ultrasound and check estrogen, progesterone, and HCG levels. If your progesterone's low and your lining's not thick, start letrozole or injectables, by the way. Egg retrieval like 6 couldn't do a fresh transfer due to, I believe it's called high estrogen levels. Norma XO, hugs and kisses always, right? And now that COVID's like, now get your vaccine if you haven't. Make sure you wear your mask, social distancing, right? But we miss the hugs and the love and the connections, all of us. But absolutely, higher estrogens aren't as good, but I transfer with high estrogens also. This is where letrozole, a little bit of estrogen, or letrozole trigger, or even a natural cycle transfer, by the way. Let's see. That's what I was told. Nope. I'm diabetic. Numbers were 700. I did the sleep. My numbers actually dropped to 70, but start keto, slow cut bread, rice, soda, and some veggies. Yalitza, get rid of all those things. Bread is deadly. Rice is deadly. Soda is deadly. In my opinion, vegetables are deadly if you eat these things all the time. From time to time. Remember, give yourself much more time to slow it down, but anything potentially is deadly if you eat it too much. Even too much fatty meat is not good, right? But you can get the gastric sleeve if you want, but if you simply just go to one meal a day and make it Maria and Craig Emmerich's keto, it's a game changer. So check it out. Oh, my good friend Ken Berry, check out his stuff with his wife Nisha on YouTube. Really amazing ideas and supporting ideas that all of us need to be supported in a better way. The more support we all have to each other, it's better. Let's see. Amanda, my estrogen dropped after my 5th day transfer. That's pretty normal. Estrogen drops after progesterone. Even 50 to 200 is fine. There's a big variability. It's not as critical as your progesterone level is. I had my retrieval Tuesday in Syracuse, transfer 10 years. Lisa B. Figueroa, we're excited to take care of you and help you on this journey. It's not easy, is it? It's a very hard journey. But you guys are all capable of the hardest things you could ever imagine. Easy, anyone can do. But why not do something difficult, right? Miscarriage, April 8th, consult June 14. How soon can I get going? Successful IVF in 18, just had an FET, 216 that resulted in a miscarriage. Rebecca Davis, you can get going right away. You can get going today. Go to Dr. Kiltz's Keto Lifestyle. Look at Kiltz, drkiltz.com. Remember, it's what you put in the mind of the mouth and how you move the Ferrari. Remember, we're the temples. We're the expensive, irreplaceable, most valuable entities created in the universe, right? That's really the key. Utero waiting period after salpingectomy. Here by Mr. 305. I don't wait. If you had your salpingectomy, you can go right into treatment. Salpingostomy, wait for the HCG to go down if it's for an ectopic. Concerned that I may have to look. Sorry. Let's see. I'm concerned that I may have to look at baseline paperwork in midway because it's the exact. I may have looked at baseline paperwork midway. Does titled uterus after IVF process, tilted uterus, Sona MCHUTIN. A tilted uterus is usually not an issue. I think a retroverted uterus that's tilted backwards may signify a little bit more inflammation in the pelvis and endometriosis. Let's see. Cat Bradley. My job is high stress and anxiety, healthcare, not understanding about my infertility appointments and Hashimoto's. So remember, you can change the stress of life by changing what you think in your body. This is why I think faith trumps facts. Have faith in God And you can change the outer world by changing the inner world, and reduce stress by changing what you think of the thing. Oh, I love my work. Oh, this is so great. But remember, one meal, make sure you could have one snack, but keep it high fat. Get in a nap, and little Tai Chi, yoga, meditation, and lots of listening. I do a ton of audiobooks. I listen to all sorts of audiobooks that are really inspiring to help all of us believe and think differently. I am fertile. I am living a fertile life. This is a great job and I enjoy it. Talk to your bosses. Ask them, is there something you can do to get some time or energy or help in this? Often we don't want to share, and then we wonder why all this stress is happening. So talk to them, and remember, all of these things can be cured with changing what you think of the stuff and what you put in the mind and the mouth. Remember that. All right. Unbearable. Husband told me to give my 2 weeks. Do you think that's probably the best because we want to get pregnant and keep my inflammation down? Listen, is fertility more important than your job? I think ultimately it may be. It is. What's the most important thing in life? Our fertility, right? And this fertile sort of journey that we're all living. But if what you're doing isn't working, change it, or change what you think of it. You got to talk to people about it. Go to therapy, journal about it. Check out the Fertile Spirit on our website. You might get some really good things in all of that. And have faith. Faith over facts all the time. That's really it. Let's see. Yalitza, it does help you get pregnant, but CMY does not have BMI requirements. Look at lowering your BMI works because you're reducing your carbs in your bloodstream, which makes you lose weight. So it's basically like when you get a gastric bypass or sleeve, they put you on a diet, which is usually lower carbs and less food, which reduces inflammation. So, but you can still have your higher BMI and reduce inflammation by going to one meal a day and having more faith, and look at yourself in the mirror, no matter your size, shape, age, weight, gender description, color description, cultural description, with love. Give yourself more love, because if you're not going to give it and you're expecting it from someone else, that doesn't work so well. You got to give it to you first. Remember that. So if you're in a plane and the oxygen drops down, put it on yourself first, then help the person next to you. That's really important. Instruct to do a trigger shot once, but the bottle says 12 hours apart. Listen to what the nurses told you, by the way. One time is all you need most of the time on those trigger shots. Rebecca Davis started keto acupuncture once a week. Huge faith for years. I'm praying goes to help and our family grow. There's so many resources, by the way, on our website, and there's so many naturopaths and chiropractors and acupuncturists, and you guys, by the way, are experts at this, right? You are the experts. Don't rely on your doctors to tell you the right answer. Google it. There's so much really good information out there that you can gain for yourself. But you've got to do something to reduce inflammation in the Ferrari. Remember, we're the Ferraris, all of us, right? It's simple. One meal a day. Remember, meditation to start the day, prayers and visualization. Journal. Put your thoughts on paper. You got to write it down. Listen to the stories that are supporting of your success. That's so critical. It will happen. You will get your success. I know it. Never, ever give up. Now, whether you're adopting or donor eggs, donor sperm, donor embryos, a surrogate, a gestational carrier, or you're finding ways to help others in this life seeking to build their families, you've got to find joy in that. If you're stressed out in your day and what you're doing, you got to change the mindset. It's always the mind is the set, right? It's like changing the set. I moved it around a little bit. I got rid of all the yik yak. Oh, you got to clean out the closet. Recommend after one failed cycles, D2B 692, second cycle to be success, endo removed in 18. it might be time to repeat the laparoscopy, hysteroscopy. Don't forget Kiltz's keto lifestyle. You might look at the Immune 3 and the Immune 4 protocol. They're on the family building guide on Amazon or through our website. There's a lot of really good stuff, by the way. This is where Lovenox, aspirin, prednisone, Plaquenil, Neupogen, and all these things. Let's see, severe fibroids, taking serrapeptase and nattokinase for inflammation. That's a good start, but something's causing the inflammation. In my opinion, if you look at Kevin Stock, Meat Health, I think is his stuff, awesome stuff. Kevin talks a lot about plants and how they're the predators. I've been talking about this for years also. Plants are the predators and we're the prey. It doesn't make sense. But I believe that fibroids like endo and all other diseases are caused by a high carbohydrate, low-fat diet, a grazing animal diet, 3 to 6 meals a day, which is deadly for us. I know. It's crazy. Joanna, thank you so much. Love you guys, by the way. I think, let's see, Joy, Femara is better than Clomid for anyone personally, but I use a lot of Femara. Don't forget ovarian PRP for lower DOR, lower AMH's DOR, intrauterine PRP for implantation enhancement, lining thickening, along with Neupogen and HCG washes. Endo, infertility, IVF. HCG wash increase pregnancy rates. Yes, I think it does. You know, you're always going to find conflicting articles out there. What does it prove? Okay, if you're looking for proof, you're going to be spending too much time looking. If what you're doing isn't working, do something different. Do or do not. Remember, Master Yoda is the master of change. How do we do keto diet being a vegetarian? Midwives tell us to snack. No, look it. You don't want to suppress nausea. Crackers are deadly. Snacking is deadly. You can simply fast. I believe that nausea and vomiting in pregnancy, it says, don't put that in my mouth. You're going to kill my body. You're going to kill my baby. It really is so simple. We, for thousands, if not millions of years, searched for food for days, if not weeks. It wasn't easy to find. Now that we have this addictive environment where crackers are everywhere and vegetables are everywhere, you should intermittently eat. I call it intermittent feasting. Shona, let's see, it's so crazy, but fasting is lasting. And fasting to me is the best way to a baby. All vegetables, all seeds and nuts, all crackers, all fiber is micronized to sugar in the stomach and the intestines. It goes to the liver where it's converted to fat. But the sugar damages the liver, damages every nook and cranny of our body. It is deadly. I love midwives. I love everyone's. But basically, if you have nausea and vomiting during pregnancy, don't eat. Ice chips, water, but a little bit, sips. Get an IV infusion if you need it, but your fat is the only fuel for the fetus. That's crazy, right? This month, Lex the Tech. Hi, Lex. Let's see. I do not have my fallopian tubes due to ectopic pregnancies. We do some blood work. I do recommend the SEMA 4 283 genetic testing, karyotype for everyone on both sides, sperm and egg. It's good information. And then we can do our new Presimune is going to be doing our new inflammatory repetitive pregnancy loss or failed implantation testing. It's coming up very soon. Excited about it. But basically, ultrasound bloods, a sperm count, and let's get you right to an IVF cycle. Low dose, mini dose protocol. In my opinion, I do a lot of letrozole 10, going left, or Follistim 200, HCG 20, an antagonist HCG leuperon trigger, game changer. That's, amazing in all of this. Intraovarian PRP during retrieval, doing another retrieval if needed. Is it safe to do a fresh transfer? Yes, I think you could do a fresh transfer if you've done intrauterine or intraovarian PRP. Angela Felix, hello. ER Tuesday, second retrieval. I think we got to that. Let's see. Will contact you, travel team. Oh, thumbs up to my travel team, my global team, my in-house financial. We're really working to give you guys the very best. We're adding more team members, but we need your help in order to keep the price down and not hire infinite number of people where I have to double my prices, which defeats our purpose in this. So we all have to work together and be patient in the process. That's really, really critical. So, all right, you guys are doing good. Let's see. Oh, my glasses are a little dirty, but it's okay. Keto for a few months. Verna, potassium when needed. Heard omnitrope may interact. I heard that too. I don't believe it. You want it. You want it. This is why the organ meats, if you're doing carnivore keto, are critical. Bone marrow, bone broth. But there are some supplements for your minerals and vitamins. Our molecular fertility supplements. Let's see if I've got that for everyone. You guys can see it. The female essential, and then the male essential. Our molecular fertility supplements, and then our ovarian bloom for DOR, even ovarian dysfunction, metabolic disorder, I think could be really helpful in all of this. Is everyone doing okay on this beautiful Sunday? Beautiful week. Thank you to Dr. Luthringer and Dr. Corley for the beautiful week of weekend work. I took it off, spent some time with Miss Dia. I just cleaned out the basement. I cleaned out my pottery studio, throwing away. But it's recycling. It's putting it in compost, or it's donating it to those in need. And we're all in need at one moment or another. Post-transfer to women, stay on LDN. JJ Patterson, I think low-dose naltrexone could be for the entire pregnancy, personally. And remember, Kiltz is keto throughout pregnancy. T-Sweet 05, what do you recommend for poor egg quality? Ovarian bloom, Kiltz's keto lifestyle are all really helpful in the female essentials. And slow it down. Get off the treadmill. This is really, really the key to all of this. We have to slow it down in so many ways. I have to do more of it. This is why I get up early in the morning. Usually by 4 o'clock, I'm up. Usually the office by 4:30. I do my daily writings and daily meditation, and I share it. But you need to do that also with yourselves, by the way. Up to my goal on the left this cycle, 3 to 450. I would go to 4, I don't know. First retrieval and priming now 60 days, omnitrope LD and ovarian prenatal. I think all those are good. I personally like lower doses, not higher doses. I go down. I go to 200, 10, 220, 10, 320, and 10, 420 are sort of my go-tos if I want to be on a high dose. I don't particularly like the high doses. I think they fry the eggs. You want a few good quality eggs and embryos, not a lot of bad quality eggs. Prenatal DHA supplement be bad thing with PCOS? No, I think it's okay. Dihydroandrosterone, DHEA, DHA. Look at fatty acids are critical for the brain, by the way, and some DHEA, but a low dose. Metabolic syndrome, by the way, is caused by a high carb, grazing animal, low fat diet. That's as simple as that. Age 40, 2.57. Should it be worried? Rebecca Davis. That's a great AMH. But remember, you can have a great AMH and still have inflammation, and the AMH looks good. All right. Christy Love, how you doing? Should I be on a diet before infertility treatment? So nervous to finally start process after my tubes removed. Listen, we should all be on a diet, right? But we should not be dying from our diet. So you got to eat something, right? But we've been taught to eat the wrong foods. To me, keto is king. Let's see. Maria and Craig Emmerich. And you may or may not be a vegetarian. I personally am more carnivarian, but there's keto for everyone. Whether you're a vegan or vegetarian, our new keto for fertility and health and wellness goes over this. Our new Fertile Feast, Kiltz's keto lifestyle for vegans, vegetarians. I'm Mediterranean, my upbringing. Pasta, bread, salad, vegetables, fruits. Oh my God, love it. But when I finally stopped it, Oh, everything changed for me. It was just a game changer that is quite amazing. All right. Fibroids, Carol, let's see, 14500. Already removed in February. New SS showed the same fibroid again, submucosal. Make hysteroscopy the same time, egg retrieval. You could take another look. Sometimes we can remove these small fibroids hysteroscopically. But again, you got to look at Kiltz's keto lifestyle, eliminating fibroids. Fibroids and endo is due to your diet, and we're dying from our diet, by the way. It's crazy, game changer. Neupogen, let's see, yes. What you could start Neupogen at the beginning of the cycle with intercourse, IUI, IVF, frozen transfers. You could start it with your transfer or even after, but I'd say start it earlier is better. I like a microgram per kilogram. I usually go up to 60 micrograms in a dose. Let's see. Renee Golding started 2 weeks keto, a consultation June 30th. It'll be here lickety split, and you're getting a lot of consultation right now. Lowering inflammation. It only takes 2 to 4 weeks. Myomectomy, adenomyosis, inflammation. The plants are the predators, and they want to kill us. Let's see. Supplements, ovarian bloom, fertile peak, low dose aspirin, 81 to 100 milligrams. Benadryl, Pepsi-Claritin. Benadryl is the antihistamine, the antimicrobial, antibiotic, antifungal, antiviral, omega-3s, all of those things. You're doing it. But don't forget, I'm having a baby. Write that down. I am having a baby. Write your letter to your baby. Put pictures on the wall of the babies you're having, the family you're building, the life you're living. And if you haven't read Rhonda Byrne's The Secret, and then I have a book called The Fertile Secret. Same concept, same ideas. If you believe it, so it shall be. If you think it, so it shall be. The negative thinking things will bring about the negative. The positive thinking things will bring about the positive. La T40, Josie, do you have to take a blood thinner? Well, you don't have to take a blood thinner, but inflammation causes stickiness of the platelets in the red blood cells that cause microvascular clotting, which happens is mostly in the capillaries. So by adding Lovenox, aspirin, prednisone, I think that really helps reduce inflammation, reduce the stickiness in the microvascular areas. So it does help a lot. Let's see. Houseplants are the killers. Yes, be careful for the houseplants because they want to kill us. But look, you got to love plants. But ultimately, sometimes you just dust against a plant and the pollen that gets in the air. We're all getting hay fever, right? Hay fever. I got to figure that term out. But look I'm sorry. The deadly things that get in the body are usually from plants and microorganisms. They're the antigens that cause the inflammation. It is crazy. Evelyn Mullins, anovulatory bleeding for weeks due to estrogen dominance, not wanting to start birth control pills due to trying to conceive. Do not use the birth control pill. You have to take either letrozole or Clomid. Kiltz's keto is a kick-ass amazing. Anovulation and bleeding for weeks is inflammation in the ovaries and the uterus. Sorry. It's due to a high plant-based, low-fat diet. Sorry. It's to eating 3 to 6 meals a day like a grazing animal. Sorry. It's crazy concepts. I know. I didn't believe it either. Mid-50s, I went 1 meal a day, carnivore keto, and I got off the treadmill. Bingo, backaches gone, arthritis, psoriasis, migraines, bowel bleeding. I'm still neurotic, as you can see, right? But you can get rid of that. And of course, you're estrogen dominant. Your body's making estrogen because that's what it does. You don't ovulate, so you don't make progesterone. That's what PCOS really is. My bet is that there's some plant antigen or plant chemical that gets in our bodies that causes the damage. To do PRP for ovaries, anytime, let's see, Sincane, anytime I think is okay there. Let's see. I've been on keto to prep for IVF for a couple of weeks. I'm down 5 pounds. Look at you might want to lose weight, but I'm not giving you this dietary change or lifestyle change to lose weight. Personally, if there's a famine, fat survives, skinny dies. This is the crazy concept of this crazy universe, right? Keto, 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 keto. That's it. Let's see. Implant success, HCG wash, endo infertility, IVF. Yes. It strengthens your uterine environment. This is why the antimicrobial, antihistamine, along with HCG, PRP, Neupogen washes, sub-Q HCG and Neupogen can help, along with Lovenox, aspirin, Plaquenil, higher dose of prednisone. And remember, when you're pregnant, stay Kiltz's keto lifestyle. It's the game changer. Listen, these are crazy concepts and ideas, but I will bet $1 billion that this will change your life. And don't you deserve a change? You're wondering what got you here, right? Well, we have to eat in order to be alive, but we've been taught via really great marketing to eat too much of the wrong thing, which ultimately is deadly for us human beings. Second IVF round and my estrogen are always low, even taking estrogen patches. What do you recommend to help the estrogen levels as well as producing more eggs? Kiltz's keto. This is where Neupogen, human growth, and do a low dose protocol. That's really it to me. Do serial stims. Anywhere between 5 and 10 days after retrieval, do another stim start. You actually don't even need to wait that long. You can start right away. But I think that's what it helps tremendously. Joy Bennett, 15, 2 embryos. It's okay with me. There's a higher risk of miscarriage and twins. In general, we're pushing 1, 1, 1, 1. Should the male be on keto diet as well? Okay, guys, and all of us, right? The female and male supplements, I think, are important for everyone, right? Let's see, the light is a little off on the Instagram, but the molecular fertility, I think, is the way to go for both. And Kiltz's keto for everyone, right? And I call it Kiltz's keto because the lifestyle incorporates meditation, prayer, slow it down, cool it down, 1 meal a day, fasting is the best way to lasting. And you don't fast like, okay, every month I fast for 2 days. Every day you fast and you get 1 meal. That's my recommendation. But if you're having problems, it's likely something that's getting into your mouth or into your mind. That's the game changer. But yes, Kiltz's keto for everyone, babies, young and old. Doesn't matter your gender description. All of us should be kick-ass keto. And this term keto, just throw it out as a label. But basically, you go keto by fasting. So you lower the carbs. You see the food in the belly, you want it to digest and clear and get into your colon to get out. But it's basically the small intestines that are absorbing all the food. But all of it goes to the liver. That's it. It goes to the liver. It's converted to fat, because your body must make fat or you die. It's simple. The reason we get fat so easily is because the human brain wants you to be fat, because it doesn't know anything about the last 200 to 2,000 years. It knows between 2,000 and 2 million years ago that getting food was not easy. And we're not grazing animals. I know. It's nutty, but you can listen, vegan, vegetarian, Mediterranean, pescatarian, carnivore, it doesn't matter what you choose. But if you're having problems, fasting is the one thing I've learned every day, 1 meal a day. If you're losing too much weight, okay, do it in 2, but add the fat. Game change. Can't fast because you take meds that need to be taken with foods throughout the day. My friend, my bet that isn't even true. I would say that false. So do them all in one time a day. But look at a sip of water, the pills go down. They will be absorbed. I don't know where we made this stuff up, but most of it I bet is wrong. Steak does not increase testosterone levels. Carbs do. Carbohydrates, they stimulate insulin. Insulin stimulates your adrenals and your ovaries to make more testosterone. It's really radically amazing and easy. But basically, fatty meat, organ meats, bone marrow, bone broth is, I think, the healthiest thing. Now, if it's chicken or fish or other meats or oysters or lobsters, I mean, but add the fat, butter, cream, salt, salt, salt. All right, 15 days post-transfer, and I found out that I'm pregnant. All right, La Tia 40, awesome. Remember, keto, keto, keto. Kiltz is keto, Kiltz is keto, Kiltz is keto. And look at Stephen Gundry's stuff on the plant paradox. Really, really good stuff. And the plant paradox is an amazing concept, but I think you need to go further than that. Let's see. Cat Rodriguez music. Second IVF round, estrogen always. You can add a little estrogen, by the way, to the protocol if we want to get your estrase. Add 2 milligrams of estrase. I don't like to use ethinyl estradiol. Just use estrase, and you can prime with a combination of estrase and prometrium and human growth and Kiltz's keto and LDN and the molecular fertility supplements. It's slow it down and cool it down. That's what we need to be doing. Check out Ken Berry, Nisha Berry, Anders Ienfeld, the diet doctor. But look you're not going to find the answer unless you test it out yourself. But you got to give yourself 2 to 4 weeks of change. Being addicted to sugar and the plant chemicals. Remember, plants make chemicals that we're addicted to. Caffeine, for one, all the other drugs, nicotine as a plant chemical that we're addicted to. Again, a game changer in all this. Thanks for joining me on this Sunday morning. I hope you guys are going to get out there, go for a walk, a bike ride. If you're going to, go for a light jog, keep it light and slow. If you're doing this and you're with a partner, make sure you can talk. You don't want to get your heart up so high that it's going to cook everything inside. Crazy stuff. Let's see. Stay on Lovenox, prednisone, progesterone, and oil, and all of this. At least to 12 weeks is my new recommendation. You might stay on some progesterone throughout pregnancy, aspirin, LDN throughout pregnancy. But again, you're going to talk to our team and talk to your gynecologist or obstetrician. All right. Stomach issues. Tired life. She's allergic to gluten and fructose. Keto should help. Absolutely. Caitlin, look at game changer. All right. I learned this about 10 years ago. I was doing paleo for 5 years before that, and mostly meditation and prayer before that, which is all good. But look I had bowel problems since I was a kid. They're all gone. You listen, potato chips and snacks and all these things that they're convincing us this is healthy for you. The more healthy things turn out not to be. You can drink too much water, breathe too much air, and eat too much food. 1 time a day. OMAD, 1 meal a day, 1 snack a day. Okay, but only 1. Where the more you buy all this stuff and you snack all day, it's causing cancer in us. Cancer is caused by fruits, fiber, vegetables, seeds, and nuts. And remember, all of these snack foods are made from grass and grains, fruits and vegetables. They're not good for us. All right. And listen, I do have my downtime energy, by the way. Today, I'm going to get into my pottery studio. I cleaned it up yesterday. Maybe I'll do some more Kiltz cups. People have been asking about handles, but I love holding a cup like this. And this is where I love to hold a cup. I don't like this personally. So that's why I don't put handles on my cups. All right. Let's see. Jessica Papp, you're taking your CNY Miracle Baby to swim class today. As I was cleaning up, I was finding some pictures of my daughter, Pilar, and do recollect those swim classes. Love them, love them. Let's see. Renee Golding. I do a ton of mini protocols. Dr. Chang, all of my doctors, Ditkoff, Grossman, Dr. Banerjee, Fink, Magarelli, all of us. Low dose protocols. Start there. 10, 220. Game on, game changed. I've just seen so many better embryos, better eggs in all of this. And duo stems, triple stems, bank embryos, freeze on day 3. You can always go to blast later, but we're very flexible on this. In general, our team is freeze on day 3, 4 or fewer, go to blast with a day 5, more than five or more by day 3. Successful complete IVF for gender. Trevor Peters. Yes, we do PGS testing for gender selection. I don't know the way to get you more boy sperm or girl sperm, but remember, you got to just hold the vision of that which you believe and that which you desire and know it will come true. Don't ever, never, ever give up. Always keep your eye on the prize, right? And have faith in God, whether it's Islam, New or Old Testament, the Bhagavad Gita, or the whatever it is, whatever your belief in higher power. Look in the mirror and see the higher power. 3 magic words. If you haven't read that book, you must. U.S. Anderson, it's a game changer. What do you do when insurance won't pay for meds? Kristen, well, through Integrity and through, Metro and Empower, and we're working on more affordable protocols and meds for everyone. ERA right after Lexington. Yes, you can do the laparoscopy in June for endo. Listen, infertility is not silent, is it? It's screaming at us. Our frustrations, our emotions. And remember, those frustrations touch every nook and cranny of our body. It changes the electromolecular interactions, right? Energy, electricity, right? So this is why the mind is critical. But I think endo laparoscopy is the way to treat. Now, you can do a medical treatment for endo. Letrozole and Lupron, or letrozole and Orilissa for 2 months is what I recommend. And yes, you could do the ERA right after that, by the way, the surgery. You guys are good? Go for a walk, take some pictures, draw something, write something, listen and read something. Go out for a light jog or light weights, or hang out with some friends and have a nice conversation. Talk about your feelings and your stresses and struggles. That's good. Write them down. But maybe reanalyze our stresses and struggles of blaming others for our problems and recognize that maybe God put all of these things in our path to teach us something, to make us stronger, to live life more fuller. It's not the money in the bank, but it's the mental clarity of life that you give this beauty of life. And no matter your size, shape, age, weight, or your money in the bank, you're a beautiful entity of the universe, and God is always creating something good for you. If you can see the good in everything, that's the game changer of life. So a couple more questions, and then I'll be on my way to the studio today and do some more Kiltz's cups. Can you PM for info as well? Let's see, Alexander, can you, I'm not very good at some of these acronyms. I apologize. Let's see. After my IUI, start with progesterone pills. I have no pills left. Can I change for injection? Yes. Add the progesterone injections if you don't have any more. The Prometrium is the one that I love the most because you can take it oral or vaginal. Get plenty of refills. Call your pharmacy and get them. Have them in hand. They last a long time. Estrase, Prometrium, progesterone, and oil. Those are the 3 game changers. And stay in low-dose naltrexone and Kiltz's keto. K-Cat's amazing. If you want to learn more about keto, Maria and Craig Emmerich, Ken Berry, look at Meat Health by Kevin Stock. Great stuff. And I've been learning to fly for 10 years now. I love to go flying. I love to continuously learning and growing. This is why I make a lot of mistakes in what I write and say and journey. But let's see. Ready to transfer one only embryo, endo and adeno, 2 failed IUIs. Praying for this my year. Absolutely. But read Kiltz's Keto Lifestyle. Read the Family Building Guide. There's so much out there that you'll find amazingly helpful, by the way. Let's see your page, PM. I can't get to your page. Let's see. Kristen Summers, rkiltz@cnyfertility.com. Send me an email. That's the best way. And I'll do what I can, by the way. And let's see, 1 day, 30 of 30 estrogen progesterone prime, still waiting on full flow period. You don't have to get a full flow period to get started if you're doing a freeze-all cycle. If you're on estrogen progesterone, stop it, get a baseline already. Sometimes you already have a thin lining on those. You don't have to wait for a full flow. We sometimes are waiting for this full flow stuff. Team, get a baseline ultrasound and blood no matter where you're at, and then we'll help you decide, by the way. All right. It's 11 o'clock Eastern time, Sunday, May 2nd. My friends, God bless. I look forward to seeing you wherever you're at in this journey. Know that God put you in this perfect place. And if you look in the mirror, God is you and I. So if you have faith and belief in God and faith and belief in yourself, God will show you the way. Have an awesome day, my friends. God bless to you. I will see you later. Keep reading and keep having faith. God bless. Bye, guys. Love you guys. Thanks for joining me.